Welcome back to the news at 4. The Susan G. Komen Race for the Cure was a couple months ago, but the fundraising for the organization is a 24/7 job year-round. Gretchen, Awad, and Anne-Marie Hinkle are here this afternoon to go over some ways you might still be able to help out, especially this time of year, and maybe get some help for yourself. Thanks, ladies, for joining us.
Thank you for having us.
So this time of year, we don't want to forget about the people who are in need in our community. We're all spending a little money here and there. We've all got stress going on. We can't forget about our breast health. And also, we want to make sure people know about resources out there.
That's right. You know, cancer is an expensive disease to have, especially if you have other family members or children to care for, or you might be living maybe paycheck to paycheck. And I just want people to understand that Komen is more than just mammograms and diagnostic and treatment services and wonderful research. It is all of those things. But this time of the year reminds us that people need financial help, and that is what Komen is there to do. We have our financial assistance program. We want to make sure people can apply and get that ask in early so we can help support you going forward financially.
And we want to make sure that people, you know, we're not just here to talk about the race. We love the race, but the race really helps Komen to be able to provide that help. Anne-Marie, you went through breast cancer. You're on the board. What are some of the biggest challenges that you see with women who are diagnosed off of what Gretchen just said?
There are so many things that people can't even imagine that women go through. Just the anxiety that nobody sees when they're trying to figure out caring for their children, paying the bills, times off work to get surgery. There's just so many complex things to diagnose and personally diagnose and try and get through in order to be healthy again.
And you're in a position, I've had friends who have had breast cancer and I say, oh, what do you need help with? Do you need help with a study or this or that? And a lot of people, it's not their first thought necessarily to think of Susan G. Komen.
I have been on the board for about 6 years, and I became involved because I have a very huge history of breast cancer. And I was definitely watching myself. And all you can do is make sure that you help friends with resources, make sure that you're available to friends, and giving at this time of year to Susan Komen is always a wonderful thing.
And what kind of help is available out there, Gretchen, this time of year, every time of year, really, with Komen?
Sure, it's a simple application process. I encourage people, if you're feeling that crunch and you're in treatment, if you've been diagnosed within about 3 months, go to Komen.org, or if you're living with metastatic breast cancer as well, go to Komen.org. You'll be connected with a patient navigator. They're going to walk you through some of the questions, financial concerns, some of your daily living costs. Our number one request through that financial assistance program is help with utilities and rent and housing. That's our number one. We also have requests for food. We have requests for childcare. We never want a woman to say, I need to go get treatment, but I have no one to watch my children, so I can't go. These are all the things.
Transportation.
Transportation is huge. So these are all things that Komen pays for. And our job here, Anne-Marie, our job is to make sure that people know to go to Komen right now. If you're feeling that crunch and you are in active treatment, please go get connected with help. This is why we race every year. This is why people donate to Komen. Yes, we are a big organization. You know, we hear about Komen all year round. We also give that money away, and we want to make sure it's getting to the people who need it most. But we also want to say, if you are in a position to pay it forward this year, we encourage you to do so. $25 helps pay for transportation for a month. It helps pay for groceries for 2 weeks. It helps pay for a lot. A $25 gift to Komen in Northwest Ohio can be a lifesaver for someone at this time of year.
Yeah, and so many of us would have friends or family to take us to those appointments or watch the kids or help out, you know, financially if we had to miss a little bit of work, or maybe we have employers who would work with us. But probably a great number, and I don't know the exact number, but I would say significant amount do not have those things. They don't have these people in their lives who are, maybe they want to help, but they can't.
Yeah.
That's true. And, you know, Transportation, you mentioned it. You know, so many of us just jump in the car and go where we need to go. People don't have cars. Sometimes there's a language barrier.
Yeah.
You know, there's all sorts of reasons that sometimes we can't even imagine until we have someone coming to us saying, this is how Komen helped me. And we go, my gosh, that didn't occur to us, but that's why Komen is there. That's why people continuously and generously give to us, so we can just keep paying it out.
People shouldn't get less than care because they can't afford it.
Right.
Well, and the patient navigator is a godsend in the fact that they will tell you expectations and what to expect with your next visit, or how to get from A to B in so many ways, not just transportation, but from doctor to doctor.
Website, best way to donate and reach out for both services and to donate?
Komen.org. If you're a patient, we'll take you to the patient portal. They'll get you connected with the navigator. If you want to donate, you can click on donate now. Either one helps to save a life. We're grateful.
So everybody who donated, everybody who came to the race, who took part in teams, this is what that money is being used for, and they could use even more of your help during the holiday season. Thanks so much, ladies, for being here. Merry
Thank
Christmas.
you. Merry
Thank
Christmas.
you.